Since 1987, we have progressively seen an increase in many eating disorders, including obesity, anorexia, bulimia, compulsive overeating, and or even eating at night time. And these are just to name few. What goes along with the food can be a balance of life or problems of life. It all depends on how much we consume, in what manner we consume that, and what does that do for us. So having said that, at this point in time, obesity seems to be one of our largest healthcare issue. About more than 30% of people are struggling with obesity related issues, which are very, very challenging. These are certainly what I would term psychologically based difficulties. However, in addition to that, we have difficulties which arise out of those disorders, which are medical conditions, such as high blood pressure, high cholesterol, diabetes, heart problems, sleep apnea, and we have not listed, but cancer is an additional condition that can afflict people due to eating disorders. If you look at these two conditions, anorexia itself affects 1% to 6% of people, mostly women. Bulimia is slightly more than that. These conditions can be fatal if not treated and diagnosed effectively. So to say its mortality and morbidity is very high, people tend to be very secretive about that. They feel very shameful and guilty. They don't want to share what they are experiencing. And these are very secretive conditions which affect people tremendously. At one point, our standards of what seemed an appropriate body weight and what we looked like was very different. Marilyn Monroe, 5 feet 5 inches, 135 pounds, was just fine. If she was trying to make a living today, she would have absolutely no chance other than to lose weight, to become ideal body weight, which in many ways is actually being anorexic and not being healthy. So having said that, we are now having all these messages through television, through radio. You go to the mall, you go pick up any magazine, there is this pressure to look and appear in a certain manner. So we all are making a great effort to find a different and ever elusive standard of what we should look like. As these pressures grow for us to be looking thin, smart, and that ideal that we have created somehow, I don't know where it came from, but it is already there now. So we are comparing ourselves as adolescent and young adults. As they are maturing, they will have body fats in certain parts of their physique. They see that as a sign of being fat. So I have now known children as early as being in 4th grade trying to do diet or being very conscientious about their body weight. In one of the studies, adolescent girls were more fearful of gaining weight than having a cancer, or death of a parent, or a nuclear war. So you can imagine the amount of stress they have to make sure that they fit in with that standard, to look like something which is very idealistic and not really realistic. It is very hard. Folks would have low self-esteem, their own image regarding themselves is very poor. They tend to be isolative and withdrawn, and they have loss of relationships. Just imagine if a person does not feel that they're good enough, or they're not quite smart enough and thin enough, or whatever enough, how could they even build relationships, have relationships, sustain relationships, because they just don't feel adequate. So it's an ongoing battle. We see quite a large number of people coming in, eating disorder as being one of their significant concerns. We have, in our practice, we have to make a distinction between not everyone who comes in with an eating difficulty as a symptom presentation necessarily has an eating disorder. So one can be depressed and not be eating well, or one can be just in the midst of an anxiety symptomatology and may not have an eating disorder. So we have to make that differential, but after we have done that, we do see people with obesity, with overeating at nighttime, and as I mentioned earlier, a significant number of our practice deals with people who are struggling with anorexia and bulimia. We measure that by body mass index. It is what's our height, and in relationship to our height, what's our weight. And within that ratio, if somebody is 35% to 40% overweight or BMI, they would be considered morbidly obese. Anything below that would be considered obese. And then if you're within your ideal body weight and then also have a BMI within that range, then you are in a good range. It's a billions of dollars industry. Just imagine how many diet plans there have been. In our lifetime, we have seen so many diet plans come and go. Protein-free, carbohydrate-free, carbohydrate-rich, blue diet, green diet, red diet, God knows, all these kind of chatters of diet. However, when people try to go on a diet, it's very hard to sustain, to maintain a diet that's not a normal living everyday food for us. So most people who go on diets regain their weight within a year to 5 years time, and they're always struggling back and forth to maintain that identity that's ever elusive. It's very hard. It's very hard for the person who is struggling. It's very hard for the families who are surrounding and trying to help. Medically, it can be very dangerous. With anorexia nervosa or bulimia, people can go into, by binge eating and throwing up, they can get into what we call an hypocalcemia, low potassium in our body, which really can cause heart attacks and heart failures. So in severe situations, these can be very dangerous. In other situations, it can cause loss of work days, loss of relationships, loss of just being effective in life. It's very hard, but people turn to get some help when they are having so much of dysfunction in their life, their marriages, their relationships, and other elements are getting affected, or work, or leading a normal life is affected, then they turn in for help. That's true for almost everything, whether that's depression or trauma issues, but here it's particularly more difficult since it's very shameful. People feel so guilty. You know, I'm going to come and tell the doctor, you know, I just binge eat and throw up. It's not even fancy to talk about these symptoms, but yet that's what people do. In adolescence, we see the parents generally bring in for treatment because they have seen them exercising a lot, or not being able to eat well, or finding some of their secretive habits at nighttime or daytime. So that's how schools sometimes will make referrals, or parents will bring them in. And at that stage, it's really very hard to be able to reach an adolescent girl or a boy to be able to kind of get their attention. I would say 25 years, 20 to 25 years, that's when we begin to get people coming in a bit more spontaneously. I'm on my third relationship. I just sabotaged my relationship. I'm not good enough. I'm not thin enough, and so forth. And I want to have a relationship. So those will be some of the potential reasons why people come in, not being able to maintain a relationship, or not being able to be effective in their life in many other ways. So something that bothers them then brings them for care.